Hello everyone, welcome to Move Well, Live Well. We've been getting a number of people coming in here with issues regarding their shoulder and or neck, the varying frequencies. It's either shoulder or neck, and what we're finding, what's going on with these folks, is they're having issues with their pull-up. And they're either doing it incorrectly, or they're compromising their shoulder doing their pull-up, or they're compromising their neck doing the pull-up. So the thing that we're instructing these folks to do when they're doing their pull-up is, number one, if you want your shoulder to be in a better position as to not injure it, you need to be able to have what we call an active shoulder. Hey, Dr. K, if you would come over here and kind of come behind me. And what an active shoulder is you're here, and a lot of people, when they come down in the pull-up, they'll come to a full relaxation of the pull-up. So their arms come all the way down. But what you want to do is you want to keep those shoulders active. So an active shoulder, see, this is a totally relaxed shoulder, and they're coming down, and they come down too hard, and they're pulling some of the muscles in their shoulder, and they're getting shoulder pain. So what's happening is they're coming down from the pull-up, so they come up and they come down the pull-up, and they're coming all the way down with a full force of their body, their weight of their body, and it's hurting them. So they're doing this. So the ideal thing is to keep that active shoulder as you're doing the pull-up. You can see the difference. This is a totally relaxed, like I'm stretching, but then there's the active shoulder in here. See that? So that's what you want to do as you do a pull-up. You want to keep an active shoulder. I'll demonstrate here. So you're keeping that in an active position. Does that make sense? Another thing we're seeing is, like, for instance, their neck. So as they do a pull-up, they're doing this, and they're going to extension as they do the pull-up. And now they're compromising the stability of their spine. Ideally, you want to keep your spine in a nice neutral position. So your neck is going to be in a nice neutral position as you do this movement here. And now my spine is a nice neutral movement. Another thing we're finding also, so not only shoulder and neck, but even low back. And what a lot of people do when they do a pull-up, they do it this way. So they have their feet like this, and now my low back is in a hyperextended position. So they're here, and then they're doing the pull-up. They have their shoulders, they're active. They have their neck, it looks pretty good. But then they're doing this. And now their low back is in this hyperextended position. Ideally, you want to keep the spine in neutral. So in order to do that, you need to have the feet in front of you here, keeping the shoulders active. Spine is in neutral position, and you're here as you do the pull-up. Now, your spine, your neck, your mid-back, your low back are in nice neutral positions as you do the pull-up. And your shoulders are in a nice active position. So it's almost like you're almost trying to bend the bar. Kind of like if you're doing a bench press, you're bending the bar. So you're creating a little bit of torque in your shoulders to keep them active. If you come down here, you leave your shoulder in a vulnerable position to get a muscle pull or other damage. So active shoulder, your feet out in front of you, not behind you, feet out in front of you, and your chin is about a fist size between your chest and your chin. So you put your fist right there. That's a good, nice cue for a good position for your neck. So you're in here as you do your pull-up. If you have any questions with this video, leave them down in the comment section below. We thank you for watching. We appreciate it. Please like, subscribe, and share. And when you hit subscribe, make sure you hit that bell notifications button so that way you don't miss any videos coming up here in the near future. We appreciate you watching. We thank you. We'll see you next time. Take care. Bye-bye.